Hello, my name is Dr. Mroueh. I'm a fertility specialist at Boston IVF in Rochester, New York, and Syracuse, New York. I've been a fertility specialist for more than 30 years now. And today our topic is about starting fertility treatment. People always ask us, when do I start fertility treatment? How do I prepare to start fertility treatment? And the idea, honestly, is that if you feel that there is a problem, if you are older than 35 years and you've been trying for 6 months and you have not conceived, if you are younger than 35 and you've been trying for a year and you haven't been able to conceive, it's really time to start fertility treatment. Now, what can you do to optimize, the chances of being successful? The first one is being healthy. What does being healthy mean? If you have a medical condition, high blood pressure, diabetes, any medical condition, you want to make sure that it's really well controlled. It will help a lot. Uh, it will be a good idea to be taking a multiple vitamin, especially folic acid, that is needed to prevent abnormalities of a future baby. Also, we get a lot of question about what's the ideal weight. And one thing I always warn my patient is that we don't really want to waste too much time trying to lose too much weight. Losing weight is not easy, it's frustrating, etc. And I know a lot of people who say, I want to get into an optimal weight before I get started with my treatment. The problem, though, is time is always of the essence with fertility. And for this reason, it's good to consult with the fertility specialist ahead of time rather than getting frustrated, wasting month after month after month trying to lose weight. Other than that, really, as I said, the sooner you discuss with a fertility doctor, the better. Time is important. You have a specific number of eggs. As you get older, the number of eggs, the quality of eggs is going to decrease. The sooner you start fertility treatment, the better it is. I know that some doctors, will tell their patient, oh, keep trying, you're fine. And again, the magic numbers are if you are trying for 1 year and you're younger than 35 years, it's time to start fertility treatment. If you're older than 35 years and you've been trying for 6 months, it's time to get started. I'll be happy now to answer your questions. And, the first question is, how long between the initial visit for egg freezing, lab work, and then hearing an assessment of the results? Usually it takes, depending on the testing that has been done, the most important test is to find out what your ovarian reserve is. In other words, how many eggs you have left. So that usually takes a week to get that result back. Sometimes, though, we do a lot of genetic testing, and those might take 2 to 3 weeks. So I guess a good number is approximately 2 to 3 weeks from doing the testing till you get the result, and then discuss what's going to be the best treatment, what's going to be the best protocol for you if you decide to do egg freezing. The next question is, what can I do to prepare for starting fertility treatment? What are the best tips? Honestly, take a multiple vitamin. Folic acid is usually adequate, but it doesn't hurt to take a prenatal vitamin or a multiple vitamin specifically, specifically for women. Other than that, as I said before, try to be in good health. There's really no special diet that you have to follow. If you feel you are overweight, try to lose some weight. But as I said before, don't try to wait too long, delaying treatment in order to lose plenty of weight, because again, time is of the essence. Other than that, there is really nothing specific that you need to do to prepare for starting fertility treatment. If you have any testing done through your regular gynecologist or your primary doctor, make sure you have all those results available to us. So when you meet with your fertility doctor, you have all those results and we don't need to repeat them. The next question is, does part of the fertility workup tell you how many eggs and the quality you have before retrieval? We have tests that basically measure your ovarian reserve. We have a test called AMH, or anti-Mullerian hormone. We can do what we call FSH and estradiol level on day 3 of your cycle. We can do an ultrasound to look at your ovaries to see what your antral follicle count is. In other words, look to see how many little eggs on your ovaries, which will give us a good idea about how many eggs you have. Now, ideally, number and quality go together. We worry if a person does not have enough eggs that the quality is compromised. Having said that, though, the most important factor about egg quality is going to be the age of the patient, the age of the woman. You know, a 42-year-old that has plenty of eggs is really does not reflect the quality of those eggs, you know, because we know as a woman gets older, the quality is going to decrease. And the woman who's maybe 28 who doesn't have many eggs, we still expect that some of those eggs are going to be really good quality. So again, we can tell, you know, how many eggs you have. We can guess the quality of the eggs before retrieval based on those tests of ovarian reserve, taken into account your age. Do you mind talking a little bit about the different types of fertility medication that are used before considering IUI or IVF? So in fertility, really, we don't have that many medications, and it really depends on your condition. For example, if a woman does not have a regular period, if she's not ovulating, if she has what we call polycystic ovarian syndrome, then there are 2 oral medications. One is called Clomid or clomiphene citrate, and the other one is called letrozole. The brand name is Femara, Femara. And those are the 2 medications that we use most frequently in women who are undergoing insemination or in women who do not ovulate. There is really no other medications that are needed at this time. For IVF, we use different medication. The most important one is a hormone that your body produces. It's called FSH, or follicle stimulating hormone. But there is really nothing that you need to use before considering IUI or IVF except for vitamins. And again, if you do not ovulate, you don't have to do IUI. We can just give you Clomid or letrozole to make you produce an egg for a few months. And if you're not pregnant by then it's time to move on to IUI or IVF, depending on your condition. How long does it take from the initial consultation to starting treatment? As I said before, the consultation, you know, we're going to order some tests to get the results of the test 2 to 3 weeks. Once we have the results, you know, we meet again. We discuss the result of the test, the best treatment depending on your condition. Do we need to do IUI? Do we need to do IVF? Do you need to freeze your eggs? We will discuss on that, and then we can put a treatment plan and then get started, you know, a few days later, a few weeks later with the treatment. What are your thoughts on genetic testing? I think, you know, in this age, you know, in 2025, genetic testing is extremely important. We recommend it. We advise people to do it. You know, there is some guidelines. For example, any woman who want to get pregnant need to be tested for at least cystic fibrosis, spinal muscular atrophy, any blood disorder like sickle cell disease, like anemia, like sickle cell disease, like thalassemia. So those are like routine done on any woman who's trying to conceive or who is pregnant. Those are routine tests. Now, lately, instead of testing only for those few conditions, genetic testing can have testing for 500, even 600 different conditions to see if you carry any of them before you start any treatment. Because if you carry any of them, and your partner carry the same ones, then the baby has a 25% chance of being born with a disease. And this can be avoided if we know that this is the case, because then we can do in vitro fertilization. We can test each embryo to make sure the embryo does not have that disease. And then we can put an embryo that does not have the disease back inside the womb for a woman to get pregnant. So I think genetic testing, especially that lately, we're discovering more and more conditions. There are conditions associated with some cancers, etc. And if we know about those conditions, we can try to prevent the birth of a baby who is affected by this condition. Uh, So that's about genetic testing. Now, if you're asking about genetic testing of the embryo, you know, now, as you know, we can do a biopsy of the embryo. In other words, once the embryo reaches a stage that we call the blastocyst, once the embryo look good to freeze, we can take some cells from the embryo, send them to the lab, and the lab will let me know, this is a baby, this is a healthy boy, this is a healthy girl, this is a boy, but he has Down syndrome, this is a boy that has extra chromosome, etc. And if we're looking for a specific disease that you carry, that your partner carry, or that both carry, we can look specifically for that disease, again, to try to prevent the birth of a child who is diseased. So genetic testing is a good idea to do. Again, it depending what exactly we're looking for. So it's a good idea to do it. Having said that, if I have a patient who's really, really young, a woman who's really, really young, I don't think we really need to test the embryos to see if they carry any disease, any chromosomal abnormalities, because those should not be that common in this age group. Unless somebody want a bank embryo, somebody may come and say, hey, I'm 30 now, I'm not planning on having kids until I'm 37. I would like to bank some embryos. Then it's a really good idea to test those embryos. So at least you know that the embryos that are stored are normal, genetically normal embryos, rather than to rely on some embryos that may not be normal for the future. Next question. Does Boston IVF have an in-person office in Rochester? Yes, we do. It is located on the campus of Unity Hospital in Greece in Rochester. And, there is a provider, myself, we have a nurse practitioner, and soon we're going to have another doctor too available at this location. The next question. I am 42-year-old and just had a failed IVF surgery because of fibroids, and blood vessel was wrapped around my ovaries. I only had 3 follicles and we did IUI. I did not get pregnant. Should I remove my fibroids first? Should I try Ozempic to lose weight? As I said before, it's important to be healthy. Losing weight is not a bad idea, but it might delay treatment, especially if people are on Ozempic and they're having IVF. We need to stop Ozempic 2 weeks before we start the IVF cycle. And as of now, it's recommended to stop those medication that help lose weight, Ozempic, Mounjaro, Wegovy, Zepbound, 2 months before we put the embryo back in. So you really have to balance, how much do I want to delay getting pregnant, especially when you're 42 and time is of the essence versus trying to lose weight. Should you remove your fibroids first? If you're undergoing in vitro fertilization, then probably it's better to get the eggs out sooner rather than later. And then you will decide before putting the embryo back in if removing of the fibroids is necessary or not. For example, if removing the eggs is very difficult because of the presence of the fibroids, then you have no choice. You need to remove the fibroids before undergoing IVF. But if the fibroids are not in the way, at age 42, I would recommend removing the eggs first, making the embryos first, and then you can remove your fibroids later before putting an embryo back in. I hope that answers your question. The next question is, when doing IVF, which is better, transferring frozen embryos or fresh embryo transfer? Uh, my partner has low sperm count, but the average motility, and I have low average AMH at 1.5. I'm 29-year-old. So back in the days, like 15 years ago, fresh transfer was better than frozen. Now they're the same, and sometimes frozen is better, depending when you undergo in vitro fertilization, how high your estrogen level was. If your estrogen level is very high, frozen is always better. Now, if you only produce 2 or 3 eggs and you want to proceed faster, then you can transfer a fresh embryo. So honestly, they're pretty much the same success rate between fresh and frozen, unless again you produce too many eggs, your estrogen level is very high, then it's better to freeze all the embryos and then let your body recover and come back a few weeks later and have a frozen embryo transfer. AMH of 1.5 might be maybe on the lower side for age 29, but it's still a good AMH level. You know, you should be able to produce a good number of eggs with that AMH. It's not a bad AMH for age 29. As I said, maybe slightly on the lower level of normal for that age, but still a good AMH level, and you should be able to recover a good number of eggs going forward. The next message is somebody who's telling me, my baby girl is 14 months now. You helped me get pregnant. Thank you so much for the message. Please send us a picture through the email. We love to see the pictures of the baby. Thank you so much for letting us know. The next question is there any benefits to taking a break at all in between cycle? Would you recommend it? Medically speaking, there doesn't appear to be any benefits. Now, if you're physically exhausted, you know, from the medication, if you're mentally exhausted, if you're financially exhausted, then it's a good idea to take a break. But from a medical standpoint, it doesn't seem to make a difference. We should still be able to get a good number of eggs based on your ovarian reserve, etc. Some people like to do it, you know, one after the other, and medically speaking, there is no contraindication to that. There is really no problem in doing that. Again, as long as you are physically, emotionally ready for a second cycle soon after the first one. My next question is from a female couple. What are our treatment options? Do we have to do in vitro fertilization? And the answer, you know, without knowing much about your medical history, is no. You can have what we call an IUI or an intrauterine insemination. In other words, if your tubes are open, your uterus is normal, you have good ovarian reserve, you definitely do not have to do IVF immediately. Most same-sex couple get pregnant with insemination and do not need IVF. Again, as long as there is no issue, there is no contraindication to an insemination, to an IUI. So to answer your question, you know, you will be evaluated. If everything looks normal, hopefully you'll get pregnant, you know, with insemination, which is usually easier and more conservative than in vitro fertilization. Next question is, if you got the initial genetic testing and you and your partners are not carrier of the same thing, do you still recommend to get the biopsy of the embryo to test? So when we do the biopsy of the embryo, we check for 2 things. The first thing is, if you and your partner carry a condition, we want to make sure, you know, the baby does not get that condition. So that's one thing. Let's say you carry, for example, the BRCA, the BRCA gene, the one that causes breast cancer, etc. We can check for that. So it depends if you carry any condition, we can test for that. The other thing we test for is to make sure that the embryo has the right number of chromosome. We call it a euploid embryo. The embryo does not have Down syndrome. The embryo does not have extra chromosome that are not compatible with life, that are not going to implant or that going to end up in a miscarriage. So if both of you do not carry a disease, yes, it might be still good to test the embryo to make sure they are chromosomally normal, that there is no extra chromosome or less chromosome that's going to lead to a miscarriage in the future. So, and depending on your age also, because as a woman gets older, 37, 38, the probability of the embryo being chromosomally abnormal is elevated. So, older people may want to consider testing the embryo, but even younger people, if they want to, save embryos for the future, if they want to know the gender of the embryo, if they just want to make sure, I'm scared of having a miscarriage, I just want to make sure that the embryo is normal. Testing the embryo is going to decrease that possibility and increase the chances of getting pregnant. Next question. I've been trying to get pregnant for, sorry, I lost that question. I've been trying to get pregnant for almost a year after a miscarriage. My doctor wants me to refer to your clinic. What will be my first visit look like? The first visit, honestly, is going to be to get a good history, from you, specifically, the pregnancies that you had before, the type of delivery or miscarriage that you had, get a good menstrual history. When did you have your first period? How frequently do you see your period? How many days you bleed? How painful or not is your period? Do you have any GYN issue, any history of sexually transmitted infection, any prior surgery, cyst, fibroids, any medical surgery, any general surgery that you have in the past, any family history of any condition, what you do you smoke, do you not smoke, do you use any drugs, do you vape, how much alcohol do you drink, how much coffee do you drink, what's your occupation, and same about your partner. So this is kind of mostly of the first visit. And then we're going to decide based on the history you're going to give us what testing we need to do, what specific tests apply to your condition. And then those tests are going to be ordered. And then a few weeks later, we're going to meet again to review the results and decide what's our next step going forward. So the first visit, plus we want you to feel comfortable with us, get to know us better, what we do, how we do it, what's our success rate, what are the expectations, how easy it is to communicate with us, etc. So it's really get to know each other. More importantly, get to know your medical history, your surgical history, your family history, your genetic history, and order the tests that are needed. When do patients typically get pregnant? I heard that it can take a couple of cycles. I'm not really sure about what kind of cycles we're talking about. It's going to depend on everybody's specific medical condition, how long they've been trying, did they get pregnant before or not, what's their ovarian reserve. There is so much information that we need, so I cannot honestly answer this question at this time. The next question is, how can I avoid ovarian hyperstimulation syndrome during egg retrieval? I have an elevated AMH level or an elevated ovarian reserve. So people who have too many eggs, we worry that they're going to produce too many eggs during in vitro fertilization. And if that's the case, we worry about a condition called ovarian hyperstimulation syndrome. It's a condition that's pretty worrisome, that could be serious. And right now we have a lot of tools to avoid that from happening. We can use a specific protocol called the antagonist protocol to try to avoid that. We can adjust the dosage of medication we give you to try to avoid you producing too many eggs. if you produce too many eggs, we can give you a trigger shot that's gonna minimize significantly the chances of getting this problem. And finally, at the end, when we suck the eggs, we can give you some medication to try to prevent that condition. Also, by freezing the embryo and avoiding you getting pregnant that specific month is gonna maybe not prevent the condition, but at least if it happens, it will be of very short duration. So there is now a lot of, weapons that you have to try to prevent that condition. And even though we cannot prevent it 100%, I think we can prevent it at least 99%. And if anything, we can make the duration very, very short if it does happen. What is the ideal AMH level, and when in your cycle should you have it checked? The beautiful thing about the AMH level is that you can do it anytime. You can do it day 1, day 2, day 20, day 15, any time of the cycle. It doesn't really matter. And that's one of the beauty of this test, is that it doesn't have day 2 or day 3 of your cycle. You can do it anytime, any day, morning, evening, doesn't really matter. And the ideal AMH level, when it's too high, we worry about polycystic ovarian syndrome. When it's very low, let's say less than 0.5, less than 0.3, we worry that you do not have enough eggs. So depending on your age, I would say anything more than 1 will make me happy. 2, 3 will make me very, very happy as an AMH level. My AMH is 1.6 at 29 years old. What does it mean? Honestly, it doesn't mean too much at this point. You have eggs, it's not a bad AMH at all. I guess it's pretty much expected in this age group to be more than 1. I think 1.6, you have a good number of eggs. You're 29. We expect the quality of the eggs to be good. I wouldn't be worried at all about this result. I think I'm pretty happy with 1.6 at age 29. How many cycles of insemination, IUI, would you say to try before you go to IVF? If there are no major issues, just unexplained infertility. It really depends on your age. As we said before, time is of the essence. Some insurances, especially in New York State, want you to fail 6 IUI if you're younger than 35 years before you move to IVF, and fail 3 IUIs if you're older than 35 years before you can proceed to IVF. I think if insurances is no issue, doing 3 cycle is a good number. It gets frustrating for you. It gets frustrating for us. We want you pregnant sooner rather than later. IVF will always give you a better success rate compared to IUI. So if you have unexplained infertility, I think 3 cycles of IUI is a good number. If you're not pregnant, it's good to have a discussion with your doctor about moving to IVF after that. My GYN is running blood work, but did not recommend coming to see you guys. We've been trying for a year and I'm 37. I feel like it's time. I think it's time to, honestly, I trust your GYN to do the right thing. You've been trying 1 year. It's a little bit more than the 6 months we talked about. I'm hoping that after they run the blood work, you will have a good discussion with them about what the blood work means, and then they will tell you what's the next step. But I think, given your age, given the fact that you've been trying for a year, it's time to see a fertility specialist. Now, your doctor may just be running the blood test so he can send you to a fertility specialist with the result of those tests, and that's fine. You know what I mean? But at the same time, if after, I'm sorry about that, if after discussing, those results, you feel that it's time, to see a fertility specialist, I would strongly recommend that, given your age again, and given that you've been trying for so long. My partner and I have been trying for the past 10 years. All our tests have come back normal. we've been diagnosed with unexplained infertility. Do you recommend starting with IUR, or should we consider going directly to IVF? 10 years, honestly, is a very, very long time. I will be more rather than less aggressive in treating you. Uh, you worry about, the problem with unexplained infertility is that it's unexplained. We really don't know what is going on. And sometimes when you do in vitro fertilization, you finally get to look at the egg, you're finally trying to look at how the embryo is developing. So you can learn so much more by doing IVF than by doing insemination. Just because it has been 10 years, I'm a little worried about that. It doesn't mean that you shouldn't do IUI, you shouldn't do insemination. But I think after 10 years, and again, depending what age you are, I mean, if you're 29 and you have good ovarian reserve, maybe trying few IUIs may not be, you know, uh, may not be too bad of an idea. But 10 years scares me, and probably I will be moving you faster to IVF rather than somebody who's been trying for 6 months or 1 year. What is your opinion on carnivore and high-fat diet with getting pregnant? Or is there a specific diet you recommend when trying to conceive? There is a lot of talks about carnivore diet and fertility. There is a lot of talk about what's the ideal weight for getting pregnant. And I mean, we have people who are 400 pounds who get pregnant easily. We have people who are, 120, like the perfect weight, 120, 140, 160, who cannot get pregnant. So again, there is really no specific diet that I personally recommend. I think it's stressful enough to have to go through this whole fertility treatment. You still need to enjoy what you're eating. I mean, eat healthy, you know, eat healthy. A Mediterranean diet might be the best idea, honestly. If you feel you're overweight, eat healthy, exercise. But I will not recommend only a carnivore diet or a high-fat diet, for people who are trying to get pregnant. I know there is, again, a lot of talks about that out there, that it might improve your fertility. I don't think that it's based on strong science at all. My recommendation is to eat healthy, take good care of yourself, take good care of your weight, exercise, and don't try to stress your body more than it's stressed by the thought of having to go through fertility treatment. I mean, fertility can be mentally exhausting. Don't try to add more to it by trying to go on some fad diet. Why might someone experience a chemical pregnancy even after doing genetic testing? This is always a difficult topic, because once you test the embryo, you feel comfortable, this is an embryo, it has been tested, it's chromosomally normal, we know it's a girl, for example. Why didn't I get pregnant? Why does everything look so good, yet I did not get pregnant? And it's very frustrating. But if you look at the national data, you will see that, depending again on your age, even when the embryo is tested, there is a possibility of not getting pregnant. Let's say you're 25 years old, which is a good age, there's still maybe a 20-25% chances that even though you put an embryo that tested, that you will not get pregnant. And there is a lot of concern about that. One concern is implantation. Is there a problem with your uterus? And there are now new tests about implantation. Do we need to do those tests or not? Most of those tests, honestly, are not very, very helpful. We feel that most of the time it's a problem with the embryo itself, that even though it's chromosomally normal, the development of that embryo, it's not developing adequately inside of you. And that's why a pregnancy does not happen. Having said that, it doesn't mean that transferring another genetically tested embryo is not going to work. Most of the time, it ends up working well. But again, we feel that the reason, you get a chemical pregnancy is that because the development of that embryo was not normal, even though on paper, again, it looks like chromosomally normal. We look at it under the microscope, it's dividing well, it's a good grade embryo, but once it's inside, it might not have developed adequately, and that's why, unfortunately, it ended up in a chemical pregnancy. The next question is, how does acupuncture affect IVF cycle? When should it be done related to egg retrieval and the embryo transfer? So, there has been lot of talk about acupuncture, and there is lot of studies. I think I will summarize it in this. The studies that showed any benefit, and it is still controversial because the studies, you have some study that suggest a benefit, some not, but I think there is kind of an agreement based on some science that doing the acupuncture before the embryo transfer, before the date of the embryo transfer. Let's say you're having an embryo transfer tomorrow, doing an acupuncture today might, and again, I'm saying might with a question mark because all the studies do not agree on that, might improve the odds of implantation. Now, definitely, if the embryo is abnormal, doing all the acupuncture in the world, if not gonna make a difference. If the lining of the uterus is not adequate, again, doing acupuncture will not, will not improve the odds. I tell my patients usually, you do what can relax you before you go through this whole process. If getting needles stuck in your skin relaxes you, go for it. There are studies, though, that show that there is a little bit of a better blood supply or improvement in blood supply to the genital organs by doing acupuncture. But as I said, the studies are very controversial, and it's not really something that you feel you have to do in order to get pregnant. Maybe it will improve blood supply, but will it really improve the chances of getting pregnant? It's still up for debate. My AMH is 0.27 and 39 years old. Is that good for IVF? I mean, this is a very low AMH level, which tells me that you don't have a good ovarian reserve, you don't have too many eggs. At the same time, it doesn't mean that you're not gonna get pregnant. It's definitely worth trying a cycle of IVF, to see how many eggs the doctor is gonna be able to obtain, how healthy those eggs are, how many of those eggs will fertilize and become embryo. But unfortunately, it's not a good AMH. But again, it doesn't mean you're not gonna get pregnant. All we need at the end of the day is one good egg that's going to develop in a good embryo. I wouldn't wait to, to seek treatment. And at the same time, I will keep in mind, that the odds are not very, very high, but there is still definitely a chance of this working for you. About how long can someone expect an IVF cycle to take from start to finish? So usually we start medication, to stimulate your ovaries to produce more eggs. The average length that people take those medication is around 10 days. It could be 9, it could be 11 or 12, rarely more than that. So assuming 10 days of medications, and then 2 days later you have the eggs taken out, and you're basically done. Now if you're having a fresh transfer, then 5 days later, after taking the eggs, 3 days later or 5 days later, the doctor is gonna put the embryo back inside. So now we're talking 17 days from start to finish on average. If the embryos are frozen to be placed in the future, then it's really an average of 12 days, 10 days of medication, 2 days later, take the eggs out, and you're basically done. What advice would you give someone who has been trying to conceive for a year with regular periods and ovulation, going to fertility clinic next month? I think honestly, it's time you see a fertility doctor. You want to make sure what's going on. So far, at least we know you're ovulating. We want to make sure the sperm is okay. We want to make sure your uterus is normal, your tubes are open, so we can find out if there is a reason why you haven't been able to get pregnant, even though you've been trying for a whole year, or it is unexplained infertility. And if that's the case, then treatment is warranted. If there is a reason or not, it's time to get treated to help you get pregnant. Scared of fertility clinic. What tests would they run in my case? How can they find out why I'm not getting pregnant? I'm 30. When do they do letrozole or Clomid cycle for IUI? Honestly, you don't need to be scared. I know it's stressful. You need to find out. I hope they're not gonna find out something. But honestly, as long as you have eggs, as long as your partner have some sperm, you know, you should be able to get pregnant. There are treatments available out there, and honestly, you don't need to be scared. Uh, how we're gonna find out why you're not getting pregnant? I'm gonna run tests, checking how many eggs you have left, making sure you're ovulating adequately, seeing if your partner has adequate sperm, making sure your tubes are open, your uterus is normal. And once we have the result of those tests, if there's a problem, we're gonna address it. And if there is no problem, then you have unexplained infertility, and then we will decide what's the best treatment: letrozole with insemination, Clomid with insemination, in vitro fertilization. Refer your partner to see a urologist if there's a sperm issue, to see if we can improve on the sperm, etc. So I honestly don't think you need to be scared, but it's time, if you've been trying for 1 year, to see a fertility specialist. The sooner you get pregnant, the better. What supplements do you recommend? Again, there is a lot of, supplements out there. The basics are really to take folic acid to prevent the birth of a child who has a neurological issue, a neural tube defect, etc. Most of the food we eat now is fortified with folic acid. The bread that we buy is fortified with folic acid, but you can just take a prenatal vitamin. It will provide you with everything that you will need in trying to get pregnant. Now, there are recommendations about using CoQ10 and using DHA to try to improve egg quality. Uh, Again, very controversial. We recommend sometimes people take it. Some people get upset if we don't recommend them to take DHA or to take CoQ10. They don't hurt. Do they really make a big difference in helping you get pregnant and improving the quality of the eggs? Your eggs are your eggs. It depends how many you have. It depends on your age. You just cannot increase the number of eggs that you have because you're born with a limited number of eggs. Can you improve the quality of the eggs? It's questionable, honestly. So what supplement? Take a multiple vitamin, a woman multiple vitamin, because it's going to contain all the folic acid that you need. Do you want to take CoQ10? It's not going to hurt in any way. Can it improve the odds? Maybe. It doesn't hurt to take it if you want to. But the most important thing is a vitamin that contain enough folic acid. What are the pros and cons of PGTA? Any effect on the embryo with testing? So PGTA is basically when the embryos are ready, when they are 5, 6 days old, when they are developing adequately. The embryologist is going to take some cells, they're going to send them to the lab, and the lab is going to check if they are chromosomally normal or not. If they are, we call it euploid, if they have the right number of chromosome, etc. And if you want to know, they can tell you the gender, it's a boy or a girl, in case you want to know that. what are the pros and cons? I guess the most important pro is that we know that the embryo is normal, and putting a normal embryo is going to definitely improve significantly the odds of having a live baby. So doing that's honestly like the most important part of it. We will know, especially if you're freezing embryo that you plan to use in 3 and 4 and 5 years, you will feel more comfortable knowing that the embryos were tested and were normal than those embryos were never tested, might be normal, might not be, might result in a miscarriage, etc. But unfortunately, PGTA is not the answer to all, because we know that even, let's say, when a 42-year-old, undergo PGTA and the embryo look beautiful and it appears normal, the chances of having a live birth are still, they're better than not testing the embryo, but they will never reach, let's say, for a 42-year-old woman, more than 50% at the most chance of having a live baby. So that's one of the cons of it. Now, could doing the biopsy damage the embryo? It is theoretically possible, you know. Uh, it rarely happens. The embryologists know what they're doing, they're trained to do that. So the cons of it, honestly, is that you do it and you don't get pregnant and you get more frustrated. But I tested my embryo, it's normal. Why didn't why didn't I get pregnant? So there is some frustration associated with it. Usually we push for it, or we recommend it mostly for women that are older. If you're 40, it's a good idea because there is an increased number of aneuploid, of abnormal embryos. So it's a good to know, because you don't want to have an embryo transfer done just to find out later, that the embryo was abnormal. So that will save you going through that grief of having a miscarriage or having to end the pregnancy because the pregnancy, let's say, has Down syndrome, etc. Now, if a woman is younger, let's say she's 25 years old, and she asks me, should I do it or not? If she has a clean history, if she didn't have 2 or 3 miscarriages before, probably there is really no need to do it, because most embryos should be normal in this age group. Yes, some of them are going to be abnormal, but we're still counting that the majority should be normal. Now, if somebody did IVF and transfer 1 embryo and 2 embryos and didn't get pregnant, and they want to do another IVF cycle, then it will be a good idea again to do PGTA, because why didn't those 2 embryo transfer before not work? Am I producing abnormal embryos? Then it's a good idea to find out, at least that the embryos are normal, so we can rule out another issue like implantation or another problem. So the pros is that you know what you're working with. The odds of getting pregnant are going to be much, much higher if you put an embryo that's tested versus an embryo that's not tested. The cons is that it might give you, false confidence that, oh, I'm going to get pregnant. It's normal. And as I said, theoretically, there could be damage to the embryo. I honestly haven't seen it forever, like an embryo damaged by a biopsy, but it's always a theoretical, things that could happen when you go through that process. Uh, who do they make you stay on meds if they believe it's a chemical pregnancy until your second blood test? My HCG was low after transfer. Well, because we're hopeful, let's say you did an embryo transfer and, you're taking the medications and your pregnancy came back lower, let's say 10, 15. I mean, we've seen pregnancies with 7 and 8 levels who ended up being live birth. We're hopeful that, the pregnancy is going to be fine. That's why we keep you on the medication and we repeat the blood test 2 days later. Now, if we repeat it 2 days later and it's very low, it didn't double, it doesn't look good, then we're going to stop the medication. I mean, our aim is not just to put you on medication, but if the first test is positive yet low, it's okay, be patient. We're hopeful that maybe this will be a good pregnancy. We'll repeat it 2 days later. 2 days of being on medications more with hope of getting a healthy baby at the end of the day is not asking for much. Uh, that's why we do it. That's why we keep you on the medication and we repeat it. The next question is, my doctor says that after 4 retrievals where I only made one embryo to test per cycle, that my chances naturally and with IVF are the same. Is this true? I'm sorry, I'm just trying to understand the question. So you had 4 retrievals. We made one embryo to test every time. Are my chances naturally and with IVF are the same? I mean, this is the problem. We all need a closure point. You can't keep putting your body, yourself, through this emotional, physical roller coaster of going through medication, egg retrieval, etc. So your doctor is trying to be honest with you based on the results of your cycles. And I know it's a very difficult decision to tell somebody, listen, you need to stop treatment or you need to use donor eggs because working with your eggs based on the quality, based on the result of all the IVF cycle is not going to work. Not because we don't want to treat you, but because at the same time, we don't want to waste your time, waste your money, put you through more treatment if we feel that the odds are minimal. What does minimal means? Usually we like to say if the odds are less than 5%, less than 3% of having a live birth from the treatment, maybe it's time to stop treatment. Again, it's not because we don't want to treat you, it's just because we feel we don't want to put you through more, uh, physical, mental, financial stress if we feel that the odds are not good. But no doctor will stop treatment if we feel that you have good odds of getting treatment. So what your doctor is trying to tell you is that, listen, with the result of your IVF cycle, if you just have intercourse with your partner or if you go through IVF, the odds, unfortunately, are going to be the same because they're very, very low. And your doctor doesn't want to put you through more stress, through more treatment that he or she feels are not going to result in a live birth. You can always, though, get a second opinion to see if it's worthwhile to keep going. But at the same time, you need to trust your doctor that he's trying to make the best decision in your favor. The next question, does stress play a role in getting pregnant? It was evaluated many, many years ago. There were really very, very good studies. And the answer to that, which appeared to be not very smart, is that no, it should not play a role in trying to get you pregnant. Stress should not play a role in trying to get you pregnant. We want you to be relaxed. It is stressful. It's very stressful. It's stressful for us as your doctor treating you. We want you, let's say you're going through IVF, we want you to produce eggs. We want to get eggs. We want the eggs to be healthy. We want the eggs to fertilize. I mean, every day is very stressful for us. So I imagine how stressful it is for each one of my patients. It's a very stressful process, but you need to find a way to handle the stress, going for a walk, exercising, doing acupuncture, talking to a therapist, etc., whatever will help you relieve your stress. But stress itself is not going to affect the quality of the eggs or the quality of your embryos. The next question is, does high prolactin affect anything? Yes. I mean, we don't like a high prolactin. We want to make sure why it's high. We want to control it if we need to, but also it depends what high means. Is it extremely, extremely high? It's just slightly above normal. Is there a reason why it's high? Do you have a pituitary tumor? Is there a reason for that? So, we can test and check on that to find out how high it is and if it's going to have any effect or not. How big do the follicles need to be able to retrieve them? Usually we like the follicles to be 18. That's the average that we look for. But if it's 16, we're still gonna go and try to get the egg from there. And most of the time we can get a good egg from there. If it's 20, it's fine. So the average is gonna be 18 plus or minus, but that's the egg that we like. Like I will not take somebody to retrieve her eggs if it's 12. I want them to be 18 plus or minus 2 plus or minus 3 to get the eggs. But the ideal size that we're looking for is 18. And this is how we make our decision when to retrieve the eggs based on that average of 18. My next patient is 38 years old. She had 2 successful IVF pregnancy at 33 and 35. Wondering what my chances are at 38 with normal tested embryo. If the embryos were created, depending when those embryos were created, if those embryos were created when you were 33 and 35, then the odds are as good as a 33 and a 35-year-old woman. If they were just created and they were normally tested at age 38, the national average that we report at this age is around 62%. Boston IVF has a better result than the national average. So I would say probably 75% appear to be a good number at age 38 if they are tested to have a live birth. My last question is, how many IUIs can you get before doing IVF? I mean, you don't just want to keep doing something that's not working. So depending on your age, if you're older, maybe 3 IUI, time to move to IVF. If you're younger, you can go all the way up to 6. But again, it depends on your condition, why you're not getting pregnant, why the IUI is not working. And as I said, I don't want you to keep doing the same treatment that is just not working. So your doctor will advise you, depending on your age, if it's time to move on or not. That was my last question. I really want to thank you, for listening. I hope you all get pregnant soon. I'm sorry you guys have to go through all of this. I know it's stressful. It's very stressful. Nobody expect that one day they're going to have difficulty getting pregnant, but there are good treatments out there. The majority of women are going to get pregnant with treatment, and I wish you the best. Again, thank you so much for listening to this.